I want to talk again about COVID-19. I've been thinking about this all the time. And as I've said in previous episodes, I think I have a contribution to make in terms of how to think about this issue. And in particular, thinking about the full context of this issue and really trying to look at how are all the, like, what's the full context or the big picture, and be really focused on, okay, how do we minimize the threat from this virus? But also, how do we do so in a way that doesn't undercut everything else in our lives? And I do think that the way we're addressing it is undercutting everything else in our lives and is not anywhere near the most effective way even to fight the virus on its own terms. So, and I want to cover this from the perspective of what's the goal? And that's often, I find, bad thinking begins with a lack of clarity about the goal. So here the broad topic is, what is our COVID-19 goal? And is it eradication or is it management? And I'm going to argue it should definitely be management. But first, we even have to know that there's a choice. So what's the path forward on COVID-19? This is the big question. You hear some people saying, oh, we need to go back to work. I'm one of those who says that generally, although I think it needs to be done in a specific way. Some people are saying, no, we need to be locked down for a long time more until we can really deal with this thing. And the path that we're on is what I call indefinite universal isolation. Now, we hear right now from the White House that the goal is the end of April. But as we've seen, those goals are not definite goals. And if you look at what's leading the thought and the action, it's this universal isolation policy with no particular end date. So Anthony Fauci, who's one of the most influential people on this issue, said, I think it was last week, and this I think is really bad to think of it this way. He says, if we get to the part of the curve where it goes down to essentially no new cases, no deaths for a period of time, I think it makes sense that you have to relax social distancing. So think about that. He's saying, when we have no new cases and even no deaths, that would be crazy. I mean, if you say, okay, we're going to be a lockdown until we have no deaths from the flu, you'd say, okay, well, we're never going to end it, right? But then no new cases is worse, because a case just means a diagnosed infection. And we know there are lots of people who have infections who have not been diagnosed. So then this flies totally in the face of even testing, which it has to be a huge part of the goal. And so there's this kind of, that's a really indefinite, that's basically permanent universal isolation, but slightly more modest, but still very dire. As a prescription, Bill Gates says, until the case numbers start to go down. So again, case numbers. Until the case numbers start to go down across America, which could take 10 weeks or more, no one can continue business as usual or relax the shutdown. So this is saying, really dire. We're seeing these incredibly systematic, negative, and in many ways permanent kinds of damage being done to the livelihoods of really hundreds of millions of people. And the dominant idea is, let's continue this indefinitely till we get the cases to zero or the deaths to zero or something like that. So we really need to be clear, what is our goal? And what's been happening, I think, is that there are two very different goals that have been discussed, and we're not clear on which is on what we're really trying to do, and they're often mixed together. So I'd say the two goals are, one is eradicate the virus, and two is manage the virus. These are two very different and contradictory goals. Now, interestingly, the thing that we've really been sold on is managing the virus. So initially we were told the goal is to manage the virus. We can't really contain it, we can't eradicate it, but we can flatten the curve. So this means if we slow the spread of the virus, then that will mean less strain on hospital resources. And so we'll all basically get it, but we'll get it distributed over time. And that has a definite logic to it. But what's really happened now is what we seem to be talking about is really eradicating the virus. You hear, like, we're declaring war on it, we're going to win, no new cases, these kinds of things. And this is, Bill Gates talking about there's no middle ground. And he has this, I think this is an insult to what people like me are saying and what people want. But he's saying there's no middle ground. It's, you can't say to people, quote, hey, keep going to restaurants, go buy new houses, ignore that pile of bodies over in the corner. We want you to keep spending because there's maybe a politician who thinks GDP growth is all that counts. It's very irresponsible for somebody to suggest that we can have the best of both worlds. So he's saying, I mean, he's really on this eradication premise, or at least he's not really distinguishing himself from it. And he's saying, and that position definitely has the moral high ground right now. He's talking about it like, oh, well, if you're questioning these lockdowns, yeah, you're just supporting this pile of bodies all over the place. And I want to give you 5 facts, and I'll go through them quickly. These are 5, I think, almost universally recognized facts, but they're not being integrated properly. Because I think if we recognize these facts, we have to recognize that there is that the goal we're pursuing is very, very wrong. So fact 1 is that this virus is highly contagious, and that includes it gets transmitted even when people do not have symptoms. So why does that matter? Well, that matters in terms of eradication, means that the only real ways you can eradicate it are if you have a vaccine, and we're expecting that to be non-existent for at least 18 months, or if you could contain it early. So if you really think about eradication, you either need a vaccine, which is far away, or you contain it early. And this leads to fact 2, which is that it's not contained. It's already incredibly widespread. So we can say we wish this weren't true. Maybe it would have been possible to eradicate it earlier if the Chinese had done the right things. There's some plausibility to that, but right now it is incredibly widespread. And so the implication is it cannot be eradicated, but also avoiding it for the next 18 months is cost prohibitive for almost everyone. If you have something that's contagious, like avoiding it is a very costly thing. Now, you could become a total hermit. Some people can afford that if they have enough resources and they don't have many ambitions, but hermits can avoid things like this. But we're talking about 18 months. And this is another key implication, that when we're thinking of policies, we really need to think about what can we do for 18 months. And one of the things that's, I think, dishonest about the lockdowns is people are led to think, oh, well, it's just 2 weeks. It's just 4 weeks. But if you're really trying to do anything like eradicate it, or dramatically reduce it, and you have to think, whatever you're doing, you have to think about how long is this going to last. And so one point of honesty we need is, what's the plan for 18 months, given that this thing is very contagious and it's already widespread. And this connects to fact 3 in terms of where does it make sense for people to isolate and for how long. This is a virus that's disproportionately dangerous to the fragile and elderly. So it doesn't mean that it's not dangerous to anyone else, but it is far disproportionately dangerous to the fragile and to the elderly. And so the implication of that is selective isolation makes infinitely more sense than universal isolation. The people who are at the greatest risk, it makes more sense for them to engage in isolation. And also, they are the biggest burden to the hospital system. I don't like talking about it in those terms, but it's in terms of if you're worried about the hospital system being overloaded, it's the people who are most vulnerable that are going to overload it. So it's most important, if you're spreading it out, that you spread it out among them. And yet our whole discussion, I keep emphasizing this because it's crazy that we just insist on universal isolation. And we do these crazy things like kids are at college where they could be spreading it among themselves, and most of them would be totally fine, and they'd be developing immunity, which helps in the long run. And instead, many of them who might have it are being sent home to live with their far older and more vulnerable parents, and often mixed with their grandparents. Like, this universal isolation is just so irrational. Now, a good voice on this, there's a guy named Dr. David Katz. So you can see some information here. Now, I don't agree with this totally. He has this total harm minimization framework, which I think it's too collectivist for me. I think we should be thinking of it in terms of how do we leave people free as much as possible, and then what kinds of behavior restrictions make sense for some amount of time. But what he's at least thinking of is what he calls selective interdiction. So really focusing on who are the most at-risk groups, and then how do we have the most protection and restriction of their activity so that there's not this massive harm that's being done to everyone. That's completely unsustainable if we're talking about an 18-month period. So he's somebody to check out, David Katz, MD. Now, fact 4 is really interesting. And this is one of the things that's promising, that points to certain strategy, which is that the danger of this virus, like every virus, is proportional to dosage. This is sometimes called the viral load issue. And this is a kind of common thing that's been known forever about different diseases, but it's super, super important in its implications. The basic idea is if you get exposed to it in a smaller quantity, so even if you can't avoid it, if you can get exposed to it in a small quantity, that's much better than getting exposed to it in a big quantity, because once you get it in a small quantity, you at least develop some immunity to it and your body can fight it off. But if you get exposed to a massive quantity, it's harder for your body to fight off. And I think this is why we're having these really tragic things with healthcare workers who are just getting exposed to huge amounts of it without proper protection, which is its own travesty that this has been allowed to happen. But you're seeing like their dose or their viral load is so high. So the implication of this is that there's enormous potential, not in complete isolation, which is just cost prohibitive for most people, but in terms of what are low-cost methods to reduce the quantity of exposure. And here, my expertise is not at all in what are the best methods. We need specialists for that. But in terms of how to think about it, if you know that there's this dosage issue and you know that reducing exposure is a hell of a lot lower cost than eliminating or completely avoiding exposure, it's very powerful to be looking at what are the things we can do to reduce the exposure. And so masks undoubtedly have some role in this. Not that they're a cure-all, but they obviously have some role. Social distancing. And then there's also, and I'll bring up a quote about this in a minute, things like, can you flush your sinuses, like with neti pots, if you're familiar with that kind of thing? Like if the virus is living in your sinuses or in that area, can you use techniques that people have used in places before they had antibiotics, before they had antivirals, it won't eliminate it, but it'll reduce it and it'll help your immune system. And your immune system is really like the hero in these things. So anything we can do to make our immune system do better, including less exposure to it. So, and one instant application of this that should really be considered, and I'll share a quote about this, is controlled low dose exposure. So it may make sense. Can we actually infect ourselves with it? Or some of us, particularly the younger among us, can we, if we know we're going to get infected, can we control that and have it in low doses so then we can develop immunity? And that might be the next best thing to a vaccine, which we definitely don't have for a while. But we really need to recognize the fact that dosage matters a lot, and that has a lot of implications. So there's I want to share with you two quotes that I thought were insightful. And this is from different people. So one is a physician, one is an economist. And so there's a general observation that I have, which is that dosage and viral load are barely mentioned at all. And there's this false dichotomy or false alternative of, either we're going to, either you get it or you don't get it. Whereas no, the amount of it that you're exposed to makes a huge difference. So this is Shahid Insaf, who's a friend of mine on Facebook. And he's really interesting. He has I should say a little bit about his background, and he allowed me to share this. But his background, interestingly, he has a lot of, he grew up in India, and he has a lot of experience working in places where he had very limited access to antibiotics and to certain modern medicine. So while he's a complete practitioner of modern medicine, I think people in that position, they often learn a lot about, are there other things that you can do, not in place of, but in addition to different kinds of medications to, say, reduce the load on the immune system or boost the immune system. So here's his, I'll read this quickly, but I think I can't say that all of this is right, but this is the right way of thinking about it. So he says, I've kept relatively silent about this issue, but I've had enough. Here are my thoughts as a physician, a psychiatrist, and as a former resident of India, a place where a new pathogen lies in wait every 5 steps. So just one qualifier. So he says he's a practicing psychiatrist now, but he's had a very extensive career as just a general physician and still does that kind of work. 1, viruses are common entities. At any given time, there are trillions of viruses and bacteria that are potentially in contact with your skin and mucous membranes. 2 things prevent these pathogens from causing constant infections. A person's natural immunity. B, the lack of a substantial viral load. 3, airborne viruses don't create fulminant disease as soon as they are inhaled. They settle in a person's mucous membranes in the nasal passages, sinuses, and pharynx. I think that's the right pronunciation. There is a period of incubation lasting a week to 2 weeks during which they grow. 4, when a critical mass of pathogens is reached, it overwhelms the body's immune system and enters cells through specific receptors. 5, in the meantime, the body's initial defenses, such as macrophages, have already launched attacks against the pathogen, and the body is in process of creating antibodies. 6, so a person's primary goal and concern, the only thing that's in his or her control, is to reduce their individual viral load, and he emphasizes viral load in caps. 7, this can be best achieved mechanically by using a neti pot to flush out as much of the virus as possible and to gargle with an effective agent containing alcohol, such as Listerine, which kills a lot of the virus. 8, wearing a mask as much as possible can also help in reducing viral load. 9, exposing oneself to the virus and then dramatically reducing the viral load with the above methods is the only way to assist one's own immune system to develop natural defenses to eventually fight and become immune to the virus. 10, the above method may still be insufficient in immunocompromised individuals who may need to exercise more caution. And I just want to add, because Dr. Insaf asked me to emphasize this, although I don't think it really needs emphasis because I think he's clear, but he's saying, he's very clear that, he just wants to make clear that he's not saying this is not a big deal. It is a big deal, and it's particularly a very big deal to immunocompromised people. And he's not saying that this is a cure-all or magic thing, but that this can improve our probabilities. And I really appreciate this focus because there's a certain childish quality that's going on where I think we think, yeah, we don't want this disease to exist. This disease shouldn't exist. Let's eradicate it. Let's get rid of it. But are we able to actually do that in a way that's consistent with our overall benefit? And no, we're not able to do that. So we need to be adults and recognize there is a new deadly virus in the world that we wish didn't exist, but it does exist. And so what are we going to do about it? And this is where we need to manage it intelligently and keep these kinds of things in mind. And so he said, and this seems provocative, but it makes sense to me. He says, I'm a physician who has a private practice, and I've been working through this event with my entire staff. I want someone to come in who has coronavirus so I can be exposed to it. I clean out my passages 2 or 3 times a day with a neti pot. I gargle twice a day with Listerine. I've instructed my staff to do the same. That is the only way my staff and I can become immune to it so as to help others safely. Nobody emphasized, can hide in a concrete bunker for months to avoid this. It is going to afflict everyone either this season or the next. So this strikes me as this is a very adult and thoughtful way of addressing this versus saying, yeah, let's I want to be in a bunker and I want everyone else to be in a bunker also. And the broader point here, at least one broader point here, is there's just enormous potential value in anything we can do to improve our immune system's ability to handle this. So whether it's reducing the viral load, the dosage, or whether it's anything we can do to increase our immunity. And this is where we really need guidance from experts, but it's really striking to me that there's so little talk about what can we do to make ourselves more resilient and what can we do to decrease our exposure. And that's really a crucial issue. And with that in mind, that gives me a lot more confidence in things like masks and distancing, and because it doesn't make me think, oh, I'm going to avoid it, but it does make me think, oh, well, I can lessen my exposure and I can lessen other people's exposure. Plus, I can slow the spread, but I can do these in a low-cost way. Now, one application of this idea of viral load is by an economist named Robin Hanson, and he is an advocate of what's called variolation, which has to do with deliberately exposing people to very small doses. And so he says, as soon as your body notices an infection, it immediately tries to grow a response while the virus tries to grow itself. From then on, it is a race to see which can grow biggest fastest. And the virus gets a big advantage in this race if its initial dose of infecting virus is larger. This isn't just a theory. The medical literature consistently finds strong relations in both animals and humans between initial virus dose and symptom severity, including death. The most directly relevant data is on SARS and measles, where natural differences in doses were associated with factors of 3 and 14 in death rates. And in smallpox, or in the 1700s, low variolation doses given on purpose cut death rates by a factor of 10 to 30. For example, variolation saved George Washington's troops at Valley Forge. So why are we not considering this? We really need to consider this. We really need to be adults and look at what are our options in the full context, and not let's all hunker down and stop producing and stop living and hope that a vaccine is out in 18 months. That's already being catastrophic. And fact 5 is that minimizing the threat from this particular virus is one of many values. This just is such an important thing philosophically that gets lost, where they say, oh, well, we want to save lives. But this is, you have to keep in context, what is everything else that's involved in preserving and benefiting people's lives. And so if we're talking about, oh, we're going to save lives by stopping activity for 18 months, you're going to destroy lives both in their literal length, but you're going to destroy the whole quality of people's life, which is the reason that they want to live. And so the big implication of this is we need the policy, whatever policies they are, they need to fundamentally leave us free to pursue values, including our livelihood. And one perspective on this is it's much better to have specific behavioral guidelines in pursuit of our values, such as something like distancing or even wearing masks. That's infinitely better than like a universal order in terms of, oh, no, you have to do this thing. So, oh, you have to be in your house. Even if you judge that's irrational because you're not able to get fresh air, it's hard to be healthy, you're not being exposed to sunlight, which seems to be a big deal in dealing with viruses. You're concerned that you might contaminate or be contaminated by others that you're locked down with. No, your judgment doesn't matter. You just do that. You have a business that could go bankrupt, and that's going to totally impede your ability for the next decade or two. No, none of that matters. All that matters is there's a problem, and we want to lock things down. And if you question that, then you must want to kill a bunch of people. Like, that mentality has to end. We just need a total shift. And so overall, I think of it as, we need to think of the goal as not eradication or elimination or avoidance. It's intelligent management. And so we think of things like selective isolation, exposure reduction, immunity boosting, freedom, but we're intelligently managing this as part of intelligently living our lives and trying to flourish in a free country. And we want the country to stay free. And it's only going to stay free if we recognize the value of freedom and flourishing while we're thinking about this virus. And part of it is recognize reality, recognize that we're not happy that things are the way they are, but there's a new threat in the world, and we cannot avoid it fully. We need to manage it intelligently. And if people who are on the premise of eradicate this, get rid of it at all costs, do not give them the moral high ground. That is not a mature or moral approach. That's a profoundly immoral approach that fixates on this one thing of let's avoid this virus, which that is a value, but let's avoid it. Let's prevent ourselves from getting it at all costs. That doesn't make any sense, and it's time for that position to lose its moral standing. And I'll emphasize again, the universal isolation position needs to lose its moral standing. It makes no sense whatsoever. It's almost universally accepted, but it makes no sense. So if people say, you'll see this where they say, didn't you see what happened in New York? How can you be against lockdowns? Well, whatever else you can say, it might be that the measures, the selective isolation measures weren't strict enough. But why do you assume that the universal isolation measures need to be universally strict? And that's leaving aside all the mass destruction that's occurred in trying to prevent the spread at all costs, or at almost all costs. So I'm going to keep emphasizing this selective isolation versus universal isolation, as well as these other points, because it's so crucial to intelligently managing this. And right now we are not intelligently managing this. And I wish I could say, oh, it's just one person or one party or something. But I think in general, there's a lack of this approach to intelligent management. It's being oversimplified as, oh, we care about the economy, we care about lives. No, of course we care about lives. But the question is, what's the right way for life to proceed with this new threat? How do we intelligently manage it?